Proposition 46, Drug and Alcohol Testing of Doctors, Medical Negligence Lawsuits, Initiative Statute. Plain language, required drug and alcohol testing for doctors, require that a database be checked before prescribing commonly abused prescription drugs, and raise the cap on how much people can sue for pain and suffering. What does it do? It requires drug and alcohol testing of doctors. It requires the California Medical Board to suspend the doctor pending investigation of a positive test. It requires doctors to report any other doctor suspected of drug or alcohol impairment or medical negligence. It requires healthcare practitioners to consult a prescription drug history database before prescribing patients certain drugs. And it increases the $250,000 cap on pain and suffering damages in medical negligence lawsuits to account for inflation. Long story short, this proposition can be broken down into three sections: the medical malpractice section, the prescription drug abuse monitoring section, and the drug and alcohol testing for doctors section. Let's start with medical malpractice. The state and local governments in California spend tens of billions of dollars annually on healthcare services between healthcare for government employees, government retirees, low-income people, prison inmates, mental hospitals, and other smaller situations. People injured while receiving healthcare may sue healthcare providers for injuries they received due to negligence, as long as they can prove that some harm resulted from the negligence. There are two kinds of damages awarded in these situations: economic damages, which are payments to a person for financial costs of an injury such as medical bills or loss of income, and non-economic damages, payments to a person for items other than financial losses such as pain and suffering. Lawyers working malpractice cases are typically paid a fee based on the amount of money their client receives in a settlement, and in most cases they are settled outside of court. Malpractice costs are roughly 2% of the total annual healthcare spending in California. In 1975, California enacted the Medical Injury Compensation Reform Act, or MICRA, to prevent malpractice expenses from growing to the point that doctors would stop practicing in California. There are two things about this law that are relevant to Prop 46. MICRA capped non-economic damage awards at $250,000, however there is no cap on economic damages, and it limited the amount the attorneys can receive in malpractice lawsuits. For example, attorneys can't receive more than 40% of the first $50,000, and they can't receive more than 15% of lawsuits greater than $600,000. Prop 46 would raise the cap on non-economic damages to $1.1 million to account for inflation since 1975, and it would then require the cap to be adjusted annually to account for any increase in inflation. Alright, let's move on to the prescription drug abuse and monitoring section. California maintains a registry of the most popularly abused prescription drugs issued to patients in order to try and prevent people from obtaining extra prescription drugs from different doctors in order to abuse the drugs or resell them for profit. When a provider prescribes one of these drugs, they can enter it into the database, also known as cures, so that the same prescription can't be prescribed to the same person at a different location. However, healthcare providers are not required to participate in the database or check the database before prescribing. It's purely optional, and only 12% of providers have registered to use it. Prop 46 seeks to require all healthcare providers to check the prescription database before prescribing or dispensing certain drugs to a patient for the first time. Providers would be required to check the database for commonly abused drugs like OxyContin, Vicodin, and Adderall. If a doctor finds that the patient already has an existing prescription, the healthcare provider must determine if there's a legitimate need for another one. Prop 46 would require hospitals to randomly conduct drug and alcohol testing on physicians who are affiliated with a hospital. A test would also be required when a doctor makes an error during surgery, makes a medical error, or after any event that results in the death or serious disability of a patient. Any doctor that provided care within 24 hours of these events would be tested. A test would also be required when a doctor fails to follow appropriate standards of care, and when a doctor is reported by someone else to be possibly under the influence. The hospital must then report the results of the test to the medical board. If the board investigates and finds that a doctor was impaired while on duty, specific disciplinary actions must be taken. This could include the suspension of the physician's license. Prop 46 requires the board to assess an annual fee on physicians to pay for the costs of administering the drug tests and enforcing these actions. Prop 46 requires that physicians report any other doctor to the board if they suspect that the doctor was impaired by alcohol or drugs, or if they failed to follow the appropriate standards of care. Fiscal impact. The fiscal impact of Prop 46 would be tens of millions to hundreds of millions of dollars in state and local healthcare costs. This would be due to increased lawsuit amounts, increased amounts of lawsuits filed, increased testing that doctors would order in efforts to prevent being sued, increased administrative costs by adding the drug registry to the physician's routine, increased administrative costs to the California Medical Board to enforce Prop 46, and the cost of the drug tests that will be passed on to the doctors and eventually trickle down to insurance purchasers, including the state for state employees. While it's uncertain, there may be potentially significant state and local government savings from the use of the prescription drug registry, which would lower the prescription drug costs and lessen costs associated with prescription drug abuse, less medical errors as the result of physician drug and alcohol testing, and the ordering of extra tests that could possibly prevent illnesses down the line. The legislative analyst estimates that the increased cap in malpractice damages would increase healthcare spending from between 5 and 25%. The savings from this prescription drug registry, aka cures, and drug and alcohol testing for physicians could offset some of the money lost to the cost as I mentioned before, but it's all highly speculative. From Yes on Prop 46. Bob Pack is sponsoring Prop 46 because a drugged driver killed Bob's children after multiple doctors recklessly prescribed narcotics to her. Bob wants to prevent such a tragedy from happening to other families. Prop 46 will save lives in 3 ways: by holding doctors accountable when they commit negligence by increasing the pain and suffering cap to keep up with inflation, by cracking down on prescription drug abuse. A recent LA Times investigation showed that drugs prescribed by doctors caused or contributed to nearly half of the accidental prescription drug overdose deaths in 4 Southern California counties. The database will also be secure. By protecting patients from impaired doctors. A California medical board reported that experts estimate nearly 1 in 5 professionals suffers from substance abuse during their lifetimes, and most of it goes undetected because doctors are not tested. USA Today reported that 103 U.S. medical professionals annually abuse illicit drugs. Millions of Californians are drug tested at work, including pilots. Why not our doctors? Dr. Stephen Lloyd, an internist who practiced medicine while abusing drugs and who is now recovering, said, "I worked impaired every day. Looking back, it scares me to death what I could have done. My patients and colleagues never knew I was using." The opponents of Prop 46 make many claims, but here's the truth. Prop 46 won't limit access to healthcare. Statistics show that people in most states without caps have better access to doctors than Californians do. California's insurance commissioner holds down doctors' insurance costs by regulating rates. Preventable medical errors kill up to 440,000 people each year, making medical negligence the 3rd leading cause of death in the country behind heart disease and cancer. Join Bob Pack, consumer groups, healthcare professionals, and victims of medical negligence in voting yes on Prop 46 so that we can improve patient safety, hold doctors accountable, and save lives, making sure no one has an intoxicated doctor treating them or a loved one. From No on Prop 46. Prop 46 is before you for one reason: to make it easier for trial lawyers to sue doctors and profit from these lawsuits. It's simple. When you increase the cap, you automatically increase trial lawyers' profits. Prop 46's sponsors claim this is about drug testing doctors, but the lawyers who wrote and funded this measure have never gone to the state legislature to propose drug testing of doctors. They have, however, sponsored 3 different proposals to get the state legislature to raise the cap on lawsuits and make it easier to sue our family doctors. All 3 times, the legislature rejected them. The courts, including the California Supreme Court, found the cap serves its purpose by keeping costs contained, which preserves your access to affordable healthcare. Doctors and nurses save lives. Ballot initiatives do not. Prop 46 would force many California healthcare providers to close their practices. How can this benefit anyone? Quadrupling the limit on medical malpractice will cost taxpayers hundreds of millions of dollars every year in increased healthcare costs and increased taxes and fees that will trickle down to taxpayers. Prop 46 threatens your privacy by requiring a massive expansion of the use of a personal prescription drug database. This database is controlled by the state government in an age when it's already too easy for the government to violate our privacy. The drug and alcohol testing was only added to this initiative to distract from the main purpose. The consequences of Prop 46 far outweigh any benefits. Higher costs of healthcare, higher taxes, lost access to doctors, and risking that our personal prescription drug history will be compromised and made available for anyone to see. Alright, I'm just gonna put it out there and say that I'm gonna vote no for this one for several reasons. In fact, this is the proposition I'm the surest of all of them. 1, I think a doctor's work is mired in so much red tape, procedure, fear, and hassle as it is. I don't like the idea of adding more fear and hassle. You can make 10,000, quote, helpful new laws to make us, quote, safer, but far before we get a perfect healthcare system, healthcare providers will quit and go somewhere else because at a certain point, you're no longer practicing medicine, you're practicing paperwork, and in this case, doctors would also become part-time urinators, and I'm not sure we have a need for that position at this time. 2, humans are imperfect and doctors are humans. We all make mistakes every day at our respective jobs, and doctors aren't any different. This bill will not make doctors perfect, and I don't believe that $1 million lawsuit will make them any more careful than they already are. Plus, there's already an unlimited amount of money available for economic damages. 3, the $250,000 cap only applies to pain and suffering. 4, I'm indifferent about the prescription drug database, although I do believe that people who want to abuse drugs will find a way, hell or high water. 5, I think that Bob Pack is a tool. Not in the sense that I think he's stupid or a bad person. To be frank, I don't know anything about him personally, and I'm not trying to attack him or anything, but I do think that the lawyers are using him as a tool to front their agenda. His children died because someone crashed into them who was under the influence of drugs prescribed by multiple doctors. That's kind of a reach to go through all of this. That could very well happen after this law is passed because, like I said, people who want drugs will find a way. Have you ever noticed that drunk drivers who kill people face stiff penalties? And have you ever noticed that there are still drunk drivers? Prop 46 won't stop anything it seeks to stop. I think they found Bob Pack's story and put him in front of their true agenda, which is my point 6. Prop 46ers want to make suing doctors more profitable. As the no side stated, if doctor drug and alcohol testing is what was really burdening their poor little hearts, why don't they just go to Congress or the medical board to make the new law about that? But I guess they wouldn't do that because it's just not as much fun as suing for $1.1 million. And as an aside, I'll admit I just bristle at the idea of people suing for millions for pain and suffering. I know your feelings are hurt, but $250,000 plus unlimited economic damages is enough to buy new feelings. If you vote yes on Prop 46, you are voting for drug and alcohol testing for doctors, a prescription drug registry to track the prescription of addicted drugs, and an increased cap on pain and suffering. If you vote no, none of this happens and healthcare remains the same. The Darryl Johnson Show gives a firm no to Prop 46.